chats, words of wisdom with people I admire and respect and whose work is in line with making this world a better place. And there's no one better to be on my mom chat than Erin Byron.
Thank you, Shelly.
Thank you for being here.
It's my pleasure.
Yeah. But we're at the Montreal International Symposium on Therapeutic Yoga, or MISTY. So thank you, Helene Couvrette, for bringing us here and getting us together.
Yes.
So Erin is a registered, is that what you say, registered clinical or registered psychotherapist, yoga therapist. She's Canadian. And you also you do something with the Expressive
Arts Therapist.
Expressive Arts Therapist.
Yes.
And she's an author. And she's got her book, Yoga for the Creative Soul, and the new one, Yoga for Arthritis. Is that the title? Yoga Therapy for Arthritis, with Stephanie Munaz. And I don't know if you have any information in that book on trauma or not, but that's kind of what I wanted to ask you about now.
Right. Yeah.
Is the trauma. So I know you do a lot of work in trauma, but what I would like to share with people is, if you can just take a moment and think of, okay, so there's people watching, all walks of life, different ages, different people, not necessarily just yogis, just people.
Yes.
Is there any words of wisdom that you can maybe give to someone?
Yes. So I think something that's really important for us to remember is that trauma exists on a spectrum. So whether we fit the diagnostic criteria for post-traumatic stress disorder, as the DSM tells us, or whether we just feel really icky because of certain things that happen to us or that we heard about in the world, there's this big spectrum of what we could call trauma. And in this diagnostic and statistical manual, the DSM, they give all these lists of symptoms about trauma and how you might know: nightmares, flashbacks, avoiding certain situations, negative voices in the mind, or negative beliefs, or just the nervous system being up, which again, so many of us just live in that state of chronic fight, flight, or freeze instead of our nice rest and digest mode of the nervous system. So if we feel some of these experiences happening, whether we label them as trauma or not, it seems really important for us to start to get a bit of a handle on the nervous system response, to make friends with our nervous systems, to trust that it's just trying to help us, but maybe that shortness of breath and pounding heart isn't helpful in that moment. So to recruit what our yoga teachers teach us and smooth out the breath and choose different kinds of thoughts and beliefs and treat ourselves with greater kindness than whether we're clinically post-traumatic stress disorder or just like, ugh, what a terrible day today. We're caring for ourselves, our psychology, our bodies, minds, and spirits in the way that moves us towards a pattern of health.
Mm-hmm. And that sense of safety is really important too, right? Like, yeah. And so if people aren't feeling, safe, I mean, you kind of already said that with the fear, fight, flight, but like that sense of feeling threatened, you can probably just remove yourself from the situation, or find a breath practice, or find something that makes you feel safe. Or sometimes that's hard to do on your own though, right? Like you got to get help from people and to guide you and people you can trust, who will be supportive, whether that's your best friend or a cousin or a clinical social worker, registered psychotherapist, yoga therapist, to find. And really, the more of a support network we have, the safer we can be, because there's this whole net woven that can catch us. We're not just relying on one or two people, but relying on one or two people is better than trying to do this by ourselves. Right.
Keeping secrets, holding it inside, wishing things were different and not taking action. There's always options for us to make things better. There are always people out there who will listen to us even when we feel the darkest sense of aloneness. And you mentioned safety, but sometimes embarking on that journey to work with or through the trauma is one of the bravest things any of us will ever do. That it will feel nerve-wracking, it will feel slightly unsafe, and that's where I suggest we just keep our eyes on the prize, right? Like, this can be better.
Right, with professional help and support. Because that could probably be, scary for a lot of people, but that's what you do as a psychotherapist, and you help people. What do you think about the trauma-informed yoga classes, and with or I don't know if they're calling it trauma sensitive or trauma informed.
It depends which
classes,
brand.
yeah.
I do trauma aware training.
Or trauma aware.
It depends on the brand.
Yeah, so what do you think of like that? Because a lot of that, what I've heard is like it's language or just creating the safe space, or is it a lot more in depth, or are there actual steps to take, or?
Yeah, it's interesting, right? Even that depends on the brand, where I guess I don't want to get too much into the differences between the brands, but as yoga teachers and yoga therapists, and any profession where we're working with humans, really, it's important to know who are we really working with. And I ran a yoga center for 10 years, and just based anecdotally on that, I'd say that probably 60 to 75% of the students in a yoga class are dealing with some kind of anxiety or depression. That, in fact, was the impetus for them taking yoga classes in the first place. And trauma itself is classified as an anxiety disorder. Don't get me started on that word in the DSM. So what base rate population of PTSD in society is probably doubled or even tripled for anyone in a yoga class, because these are the people who are looking for tools, right? So we all need to be aware of setting that safe space. And I've been so pleased in the last 15 years to watch the profession of yoga shift towards being more inclusive and caring about who is in the room, in terms of language, in terms of setting the space, in terms of boundaries and guidelines for behavior, how we speak to one another,
touching,
respectful touch.
Yeah, and the conversations are starting, right? Like they're out there, and there's sometimes controversy, and people have different. But the dialogue is there. At least we're talking about it, and yeah, so that's great. So what can people do if they on that spectrum that you were talking about, or they're having, anxiety or depression or more sort of clinical type kind of trauma things, like are there, I don't know, phone numbers, hotlines, or what do they look for?
Yeah,
Google or
always. Yeah, so you can Google if you still have a phone book, because some houses still have phone books. It'll be on the first or second page of the phone book, and any crisis line. You don't need to be discerning like, oh, this is a crisis line for this thing and this is a crisis line for that thing. If you call the so-called wrong crisis line, they will give you the number of the appropriate crisis line. You're not bothering anybody.
Gotcha.
So if it's that immediate, reach out in that way. And then if you're looking for a yoga teacher, a yoga class, or yoga therapist that can help you with this, or a mental health professional, then phone around a little bit, ask some questions, because we're so intuitive with who is safe for us, and that can be different for different people. But our bodies are like barometers for safety, right? And if you feel a click with somebody, pursue that relationship. Trust that teacher, at least to take 1 or 2 classes. And you're okay to tell the teacher. You don't have to give all the details, but to say, oh, I'm struggling with some pretty severe stress right now. And the teacher's a lot more likely to give you enough space to just let your practice be what it is. I used to say, how many of you cried in your first yoga class? And most of the hands in the room go up, because there's something beautiful about what we can soften into, and the degree of safety we find within ourselves through yoga. So I think there's a lot of options for us out there for struggling.
Shopping around, and then if it's a little more on that serious side, or you're feeling unsafe, maybe like through your healthcare provider, like your doctor, maybe because more and more doctors and healthcare providers are being in touch with yoga teachers and yoga professionals, so we're working together to cross-refer. Thank you, Erin, for your knowledge. This is I think an important topic, so thank you. And thank you for your work. You're just amazing.
Back at you. Thank you so much. I love you too.
Thanks for watching this WOW Chat with Erin Byron. For more information about Erin and her books, her resources, and where she's teaching, check out erinbyron.com, and check out some of my other WOW Chats with other people that I admire and respect, and whose work is in line with making this world a better place.